Events like this are critical.
This is a great partnership between community and the health institution.
It's just a great joint effort.
This is a needy and worthwhile cause.
It's a true volunteer thing.
We're all doing it for free, which is, is really rewarding.
Today's event is to help out the school children of Philadelphia. They're very interested in participating in sports, and we're here to do physical exams on them.
We want to make sure that we've answered the question, are all of our athletes healthy enough to be participating in student interscholastic activities?
We have kids who want to participate, but they can't get a physical.
Even though medical care is there, a lot of kids don't have the money to pay to get a physical to play on a sports team. And so I think this is really a shame.
A lot of our kids do not come from affluent families. Some of them are not insured.
If we can have these children fulfill this obligation, they're able to participate in sports for the whole year and never have to look back or worry about the financial burden of having to get a physical. So it's huge, huge.
Well, this physical is different from a physical I would do in my office.
This is a lot more comprehensive exam than these kids are going to get in their family doctor's office, because we have orthopedic specialists here, we have cardiologists here.
I'm working in the pulmonary section, pulmonary for lungs. We've already seen one child today who sounded absolutely normal, but when we did the pulmonary function study, lo and behold, they had asthma and that they're going to need some therapy. Family physicians may not have the equipment that we have here today.
The general practitioner may look at a child's knee and not know specifically what's going on. As an orthopedic surgeon, I've been there, I know what the internal structures are.
Every year you hear the tragic stories of kids who have sudden cardiac death, and we're trying to find them before that happens.
Every child, a boy or girl, gets an EKG.
If their history is negative and EKG is okay, they go forward. If there's any red flag there, then we have the capability of doing an echo here.
One patient had an infection on one of his valves, so he's going to be followed up by a doctor. The other patients did have some
like moderate regurgitation, things like that, that need to be looked at further.
Although it's a small risk for these athletes, it is still a risk, and when it happens, it's very catastrophic.
They have no idea about sudden cardiac issues or even health-related issues going forward, fatty foods, carbohydrates, salt intake. So there's a major benefit from the standpoint of just education.
We've identified kids that had either heart issues, or one child had a broken wrist that was completely unaware that their wrist was broken.
We were offered from the school to come here for a complete physical. It makes me feel good because if there is any problems, they'll be able to pick it up right away here.
Parents and coaches come, and the feedback I get from them is almost overwhelming. The parents are shaking my hand, thanking me, as are the coaches.
And how can you beat that for free? It's a wonderful thing.
An affair like this doesn't run on its own. It takes a great deal of planning, it takes money, and there's a whole host of volunteers.
We have a formal board of directors. We meet on a year-round basis with more of a concentration in the spring before the event. We have nonprofit status. We work closely with the School District of Philadelphia and the PIAA. All the scheduling, getting all the paperwork out to every student athlete. And we've also been able to engage city offices such as the mayor's office and SEPTA. So we provide free transportation for every athlete to be able to attend this event.
Every citizen of Philadelphia should be very proud of this effort. I saw the school buses bringing in the kids. The organization was just phenomenal.
The students here are from the Philadelphia College of Osteopathic Medicine.
As a first-year med student, it's great that under the supervision of some really great docs, I can come here and learn hands-on clinical skills.
Each year it's growing.
We started out with 100 kids down at South Philadelphia High School.
And then the second year we saw 275 kids, and it just mushroomed.
This year, we're seeing 1,500 to 1,700 kids.
In the city of Philadelphia, we have over 25,000 student athletes, and our hope is to get at least 5,000 or 10,000 student athletes within the next 2 or 3 years. So we'll need those donations to come in to help sustain our program.
Basically, all the volunteers get are maybe coffee and donuts for breakfast and a hoagie for lunch. But you know what? Even contributors to make that happen are helping this affair happen.
We give a lot of kids a chance to participate that wouldn't have a chance to participate.
Just to hear them say to one another, man, I've never had a full physical like this here.
You feel good at the end of the day.
I was an athlete when I was younger, so try to give something back if I can.
And it's a good feeling to know that these kids hopefully will be safer to do these activities because of what we've done here today.
Our goal
Our goal
Our goal
is to save lives.
To save lives.
That's the main reason why we're here.